I'm Alton Bozeman, clinical psychologist and the director of the Menninger Assessment Center. It's a structured assessment that includes formal psychological measures to assess diagnosis and help with treatment planning. We offer cognitive and neuropsychological assessments, developmental assessments, and personality assessments. That's on the broad level. Drilling down, that would mean that we offer assessments on learning disabilities, dementia, and other cognitive issues, personality disorders, and other mental health disorders. Generally, someone should consider getting evaluated when the issues that they're facing start to impact their functioning. So this could be vocational or employment functioning, but it could also be interpersonal functioning. And so when these issues start to get in the way of life, then that's a good time to go into for an assessment. Also, it might be useful for an assessment when a clinician needs more diagnostic clarity, such as your therapist or psychiatrist. They provide a systemic and evidence-based way to look at possible conditions as well as rule out other conditions. The diagnosis should also come with recommendations on how to treat or address the conditions for further treatment planning. So during the assessment process, people should expect a clinical interview, and during that, they're going to look at the history of the present illness, as far as also some demographic and history about yourself. You might also take some pen and paper or computer test questions where they ask questions about you. Some assessments will include observations. And then lastly, we might send out information for collateral sources to answer questions about you as well. The role of the psychologist is to identify measures that have been shown to be reliable and valid. All the measures we use in the Menninger Clinic should be evidence-based, as well as the overall process that we're using for the assessment. It's why it's important to make sure that you're going to somebody that's qualified for conducting these types of assessments. A diagnosis is a good starting point for understanding a family member or loved one because it gives a certain set of parameters that you can expect for that given diagnosis. In addition, like we mentioned, it also comes with treatment planning and recommendations. That includes prognosis or their ability to function in certain situations or environments. The findings can also lead to a potential roadmap to where to go from here as far as receiving the optimal treatment. Main advice would be that it doesn't hurt. So we're supportive, we listen, and we also understand that the process might feel intense because people are asking a lot of questions, and some of these questions are getting pretty deep and personal. However, we understand that, we try to be supportive.